Please welcome Associate Professor Dr. Haliza binti Abdul Mutalib from UKM. Please welcome. And the title of the sharing session is The Importance of Regular Comprehensive Eye Examination. Okay, can I have a seat? Silakan.
Okay, thank you, Adi.
Yeah, most welcome. Thanks for coming. Thanks for being here with us.
All right. Okay, good morning, good afternoon, everyone.
Yo, rasa macam morning ya?
Macam
Sejuk
tak
je.
nampak cahaya matahari. So today we are going to talk about the importance of regular comprehensive eye examination.
Okay.
Adi, have you been
Yeah.
to a comprehensive eye examination before?
Yes.
No, I'm asking you question. Okay.
I checking my eye because I have a problem with
Yep,
my eye.
okay.
I have a short-sighted eye problem because I'm wearing contact lens right now.
All right.
And I have different power.
All
At
right.
the right side 1,000 and at the left side 900 something lah.
That's quite a high myopia.
Very high. I'm very worried about my eye health.
Because we use our eyes most of the time, it's a really important sense that we need to make sure that everything is okay, because we're going to use it like for years until the day we die. So it's very, very important that everybody knows about the importance of why you have got to go for a comprehensive eye examination. Okay, it's just not like a simple eye test that you walk into a shop and an outlet, and get your eye tested just to get your power for your glasses. But it's important for you to run through a comprehensive, thorough eye examination to make sure your eye status is always healthy.
It's more than just check our
Yes.
our power, our eye power. Means that check more detail about the eye.
So this talk is actually to create awareness among the public to why they need to go through a comprehensive eye examination and what comprises of the comprehensive eye examination. So we're going to stress on this, yeah?
Okay.
Okay.
Let's listen, ladies and gentlemen. Let's go.
All right. So I'm from UKM, from the optometry department. So my specialty is in contact lenses. Okay, so we fit contact lenses on babies, on children, on therapeutic cases. So most of the time I'm dealing a lot with eye problem and how to treat it with contact lenses. Okay, so number one, we need to know why is the eye exam so important. Okay, why is it not like you just go into an outlet and shop for glasses just like that? But why do we have got to run through an eye examination? Because from the eye itself, Adi, we can actually see what's wrong with the whole total of your health status. Okay, meaning that, okay, if you do not know whether you have got diabetic, if you do not know whether you have got hypertension, okay, but see through your eyes, the window of the health, I could foresee whether you have got diabetic, you are a pre-diabetic, or you have been very bad taking care of your health. It's all going to be a tell and show thing in your fundus, in your eye.
Very interesting. I thought only check for the eye health, but also the whole body health
Yes.
condition. You
So
can
if I'm going to share a few slides. So pendek kata, if you have an health problem and you are not telling the doctor, because you don't know or you don't want to tell doctors that you have got diabetic and all, it will actually show everything in your eye. So you cannot cheat
no
the
secret
doctors.
lah.
No
When once you
secret.
check your eye, then you can find everything about your
And most
condition
of
of your
the
health.
eye diseases is all silent diseases, meaning that you don't feel the pain. You don't, sometimes your vision is still clear, but you have got eye problem, okay? So all that can only be known if you have gone through an eye examination, okay? Like glaucoma, have you heard about glaucoma? Where you have got increased pressure in your eyeball, okay? That you can't feel anything. If it has come to a worse stage, once you get up from sleep, everything goes blackout, just like
Means
that.
that there's no sign
No
about the
pain,
disease.
no redness, nothing that will tell you that you have got glaucoma unless you
No
go for
blurry
the eye
view, no?
examination. No blurriness. Okay, so one day if it strikes bad, you're going to have blindness. And all that can come
Due to the
overnight.
glaucoma?
Yes, without you knowing it. And the only way of you to know about it is to go for an eye examination. So that's why we always encourage the public to go for an eye examination, not an eye test. Eye test is just to get your power to make glasses or contact lenses. But eye examination will actually tells you whether you have got eye diseases or not.
Okay.
Okay, so many of the eye diseases are all silent disease. You don't feel the pain, you don't see redness, it doesn't come with blur vision.
So it
at an
can be
early
suddenly
stage.
blind.
Yes,
Oh,
that's
very
true.
scary.
Okay.
Oh, very scary.
So from the eye examination as well, a comprehensive eye examination will actually gives you a monitoring vision, meaning we know how much your vision has gone up in power. For instance, say a year before you check your eyes and your power was like maybe -5, and then after a year it went up to -6. So whenever there is a three steps increment, that's considered to be a pathological myopia. So again, to know all that, to follow through all that, that only can actually be told if you have gone through the eye examination.
So, can you recommend to us every 6 months or every
Yes.
once a year for us to check our eye?
For children, it's always encouraged to have a checkup every 6 months. For adults, it's always a year. And for 40 years and above, it's like a compulsory to go for an eye examination. It's just like going to IJN, doing your heart test and everything after you are 40. So it's the same thing. So if you go to the dentist every year, why not go to the eye doctor every year as well, just to check the status of your vision. Yeah, so that's very, very important. So, like what I've said, it identifies systemic health issues. Like, for instance, you don't know that you have got some issues in your body, like you have got thyroid. You know, nowadays, after post-COVID, you get a lot of diseases and, you know, the things which never happened before is happening now. Okay? So that's why you have got to go, because we can actually detect thyroid problems and all that just from seeing through the window of the body, which is the eyes. So, like for instance, you have got cataract and you don't know that it's a cataract issue. Okay, so if you don't come for an eye examination, you'll just take it as, okay, it's blur because I'm old. Okay, this is very common, it's blur. But do you know, if you don't get this cataract treated, you will have other issues such as increased pressure in the eyeball. You can have a hearing problem. So you have got to get this sorted out.
Related with the hearing problem?
Yes. Dia jadi tak dengar juga.
Because of cataract?
Because of the cataract. And if it has come to the stage where it goes hyper matured, it can cause pressure in the eye to build up and destroy all your nerves. Okay, when your nerves are destroyed, say for instance, after 2 years, you say, oh, okay, now I'm going for a cataract surgery. Then it's a bit too late. Even though the cataract has been removed, you are also going to be not seeing well.
Oh, it happened because of the abnormal of the eye pressure.
Yes, because the eye pressure kills all the nerves, all the important nerves in the eye. So it brings down your vision. Okay, then it'll be a bit too late. So to know when is the right time to go for a cataract surgery, you need to go through the eye examination. Okay, like this what I'm putting up are all common eye diseases in Malaysia. So another one is glaucoma, like what I've mentioned. You wouldn't know or you wouldn't experience blurriness if you are not very sensitive with your field of vision. So glaucoma, it attacks your field of vision. Still nampak terang, tapi it already compresses your field of vision. So you are seeing through a tunnel. You are like seeing through a tunnel.
So very limited vision view lah. Okay,
and this is hereditary. Means if your father, your parents has got glaucoma, the whole family has got to come for an eye examination to rule out glaucoma.
How to prevent glaucoma?
Through eye examination.
So
because there's no way of telling that, okay, I'm free of glaucoma. You have got to go for a yearly checkup. Okay, and we will measure. There is an examination where we will measure your pressure in your eye. Okay, Focus Point has it. We have got all the equipments to actually measure the pressure in the eye, just to tell you, okay, you are safe, your pressure is below the dangerous level. Okay, and that you have got to come again every year for a checkup. Sekali check, it's not like for the rest of your life. You have got to do an annual checkup.
So when it comes to the first stage, what should we do?
we have got to refer you to a doctor, and you will be given medication to treat it. Okay, and
like capsule pill or
it's topical drops.
any surgery?
Topical drops first.
Oh, okay.
Yeah, if it has come to a severe stage where it cannot be managed with drops, then it will be surgery. Yeah, so it's going to be different. So, what are the systemic diseases? Okay, that you can actually tell from the eye. So you can have diabetic, and you can say, oh, pakcik tak ada diabetic, pakcik tak ada diabetic. Tak ada kencing manis, tak ada kencing manis. Tapi when we look into your eyes, there's already exudates. Exudates is like nanah. Yeah, it's like discharge already in your fundus, bloody and everything. So all that can actually tells us that you have got diabetic, that you have got to go for some treatment for your diabetes. So it tells, because people who has got diabetic, and when we do eye test, it's going to be a false reading if the diabetic, the sugar level is not being controlled. Okay, so meaning if you have got diabetic and you walk into an optical shop to get your eye tested, it might gives you a false result, false reading.
So how can we get the true result?
So you have
instead
got to
of false?
control your diabetes first
Okay.
to a good level,
So
or
the
maybe
diabetic patient
comes in
have a
after.
possibility to get the false result of the eye.
Yes,
the
if
eyes
it's too high. So ideally, come into an optical shop to have your eyes examined 2 hours after your meal. 2 hours after your meal.
Then we
Then
can
you
come
can
to
get a
check.
better result. Yeah.
Better lah, not.
Yeah,
we
but
still
not
have a,
maybe not accurate, but
Okay.
better result. Okay. High blood pressure, we can see it through your eyes if you have got high blood pressure. So don't tell us that it's marginal, borderline. It's either you have or you don't have. So high blood pressure, we can actually see it through the eyes as well. We can see through the blood vessels. Okay, the blood vessels will be engorged and it's going to be very, very curvy. Okay, that's one of the signs of hypertension. Thyroid, you have got big opening of your eyes. It's engorged. Yeah, your eyes will be like bulging out. So that's one of the signs of thyroid. And if you're a heavy medication intake person, okay, you take a lot of medication, antihistamine, antibiotics, heart problem, beta blockers and all that, you'll end up with very dry eyes. Okay, so that again, we can actually tell, we can actually test out. Okay, and of course, people who has got allergy, okay, it will somehow show up in their eyes as well. Okay, they will have blepharitis, all these conditions which will become worse if you don't treat it early. Okay, so we can see a lot of problems. This is one of the example of a person who has got diabetic. Yeah, diabetic is kencing manis. Yeah, so what you get is you get lots of exudates. We call it in layman nanah lah. Okay, it's like nanah. You have got blood.
This is normal.
This is normal,
The left
and this
side
is a
is-
person with diabetic retinopathy, and you have got all these blood spots, hemorrhages, and all happening behind
So the
the eyes.
dot spot is
Yeah,
the sign of
Yeah, and it's
diabetic.
all happening behind the eyes.
behind the eye.
Depan mata, everything
Tak ada,
looks nice and white. Yeah, so nobody can tell actually that you have a diabetic unless you go for an eye examination and we look at the fundus, and this is what we're going to see. All right? So that's why it's so important to know all this.
So the dotted spot is the sign of the diabetic.
Yeah, it's already worsened already to a stage where we call diabetic retinopathy.
Oh, okay.
There's many people who are walking now who has got diabetic and they don't know about it. It doesn't show at all in your eye. It doesn't show at all until one day you fall sick and then you go to the hospital. Then only the doctor will tell you, actually you are the diabetes. So cut that short. You want to know whether you have diabetes or not? Come for the eye examination. Okay? So this is a regular vision test, like what will happen when you get into an optical shop, permis and all. Okay? You will do an eye test just to get your power right and your vision test. This is a normal regular vision test. Adi, if you perasan, these are all retis.
Macam kenal lah.
Ha.
Arwah Ibn Rizal ke?
Ya.
Patutlah macam
Saya
kenal.
check mata semua artis-artis.
Yang itu.
And then we have got this one,
Itu tak nampak sebab pakai.
Flybaits.
Oh, Flybaits.
The guy, I forgot the name.
Flybaits lah. Okay.
Okay. So eye test for whom? From babies. We do from babies right until the elderly age. So don't say, the child is still small, the baby is still very, very young, that we cannot perform eye tests. Yes, we can. And from the babies, we will know who are the potential risks, babies at risk of having some eye problem. So we have got lots of stories about babies having very bad vision. Okay, so it can start from very, very young. So eye examination, eye test should not just be for adults matter, but it should start from young, from babies. Okay, so we have got tests. The babies cannot talk or what. We have got our own way of testing the babies to see whether they are seeing well or not. Yeah. Okay, so this is a normal scenario. Adi, if you were to go to an optical outlet, they will do an eye test. Then you choose whether you want to wear a frame or you want to go for contact lenses, pay for your contact lenses, and that's it. They deliver it, and that's goodbye. So eye examination doesn't work this way because we need to monitor your condition and we give you a consultation right after that. Okay, so what usually we do is the exact thing that we do have done, to check for your power and all. But again, we are going to go for the anterior segment assessment, looking at the front part of your eye. We have got machines all over here to look at your front part of the eye. And then we are going to do the back part of your eye, looking at the, just now that we were seeing on the diabetic. And here also we have got instruments that can measure eye pressure. And then we have got color vision tests as well. Why is color vision test important?
Color vision test?
Yes. So we'll go afterwards why we need a color vision test. Okay. So what is subjective refraction? Okay. Sometimes people will say, do you have a machine to check your eyes? Yes, we have a machine, but the machine is not everything because it doesn't really tell you the subjective responses. So you need to go through a subjective refraction to know whether the power that is being set by the machine is correct, is accurate or not. Okay, because machines are not accurate. It's just an objective measurement. You need to do a subjective to know whether you have got problem with binocular vision, whether you have got stereopsis issues. Stereopsis is like 3D. Whether you have got a 3D, whether each eye is working well or not. So you have got to go through a series of subjective refraction. This is a normal refractive state. But if you just go for an eye test, they will just quickly test your eye just for the power. And they are not going deep into examining your balancing, your stereopsis and all that. Okay, so this is different, subjective refraction. And then you have this fundus photography. We have got equipments here that can actually tell the back of your eye immediately. You don't have to book yourself in the hospital or what. Focus Point has it. Okay, they
So
just
this kind of focus point has it. They just go to focus
Yes.
point to check the
Yes.
back side of our eye.
yeah. In fact, we have got all the instruments here
Yeah.
that actually can it tells the accuracy till 95% accuracy of the status behind your eyeball. So you can tell actually from here, it will tell you the result will actually diagnose already whether you are a diabetic, you are a hypertension, or you are at risk of some other diseases. It tells everything. So we have got an AI that conducts
Yes,
this.
I did it before
Yes.
the station. Okay, I've
Yeah,
ran through
they can
the
actually request for AirDoc. AirDoc.
AirDoc.
The instrument, the software is called AirDoc. So
AirDoc,
AirDoc
okay.
does all this screening and all.
Using artificial intelligence, right?
Yes, and the accuracy is 95%. So it's quite good. Okay, and this is tonometry. Ni Aming Spring.
Amin Spring. 20 baru lagi.
No, that's
Oh, this is
today's
it.
date, yeah.
Okay.
Yeah. So this is tonometry to measure the pressure in your eye. So it's a very simple equipment. They just aim the equipment to your eye. Yeah, you don't need anesthetics or what. It's not painful, and it will come up with a reading to show whether you are at risk of getting glaucoma or not.
So what is his result?
Normal.
Normal.
Okay, so this is tonometry. We call it tonometry. Okay, what is for this binocular vision assessment? Like if for instance you're already wearing your contact lenses or your glasses, and you get headaches, tired in front of the PC, in front of your laptop, or you feel that your eyes is like deviating away at night. And somebody might have said, kenapa kau nampak juling? All that kind of signs. That means you are all very much needed to go for this binocular vision assessment. Okay, so this binocular vision assessment, they will check whether your eyes is balanced or not. on both eyes. So sometimes you get
The line.
the alignment.
The
So
alignment,
sometimes you are good on one eye, you are no good on the other eye. So what they are going to do is to balance out both eyes. So we have got this orthoptic test as well. Orthoptic is to test for juling, for squint, for squint.
So can it be treated with the squint eye?
Squinty eyes, yes, it can be treated to some extent. Okay, there's therapy and there's a lot of exercises to be
Surgery?
done. Yeah,
Surgery?
surgery will be the last resort. So that's the last resort for squint patients. But before we can actually diagnose you have got squint or what, you need to go through all this examination. Okay, like for instance, you already gone to get your glasses and everything, but you still have this pening, every time is always the same complaint. Then this is what you need, a binocular vision assessment. Okay, all right. So other than that, we have this color vision test. So why color vision? Is it just to rule out whether you are colorblind or not? No, it's not that, because it's not as simple as that, because it actually can tells you whether you have got an eye problem or not. People who has got diabetic for a long time, they have got color defect issues. Okay, you know,
So
people with
this process is not to check our color blind, but it's for another purpose.
yeah, it can be for other purposes as well. It's just not treating the, it cannot be treated, okay? But this is just a diagnosis to know whether you have got dementia issues. You know, like if you were to get if you have got this Parkinson's disease, or if you are taking a lot of malaria anti drugs, it will show up in Ishihara. It will show up in your color vision test. It's not just about, to define whether you are colorblind or not, but it can be an early result that shows that you have some changes at the back of your eye. So if you already have got some changes at the back of your eye, then we will start interrogating what systemic issues that you have. So it can be like like a assurance. If you pass the Ishihara, then that means you are okay. You don't have any problems that, we don't foresee any problems in near future. Okay, so the last one, slit lamp biomicroscopy, we have got it there as well. So this is to see what is happening at the front part of your eye. Nampak macam okay kan? Nampak macam putih. But sometimes you have got very dry eyes issues. When you have got very much dry eye, you have got to be treated. If you let it be, or if you have got a lot of dust and dirt on your lashes, and you just leave it like that, very soon you're going to get blepharitis. You're going to get infection of the lids. You have got to get infection of the meibomian gland, and that is going to be very uncomfortable. That's why sometimes you see people walking around having very red eyes, smoky red eyes, and their eyes is not in good shape. So this is what you have got to do. If yes, you have got dry eyes, there's always modes of ways and to treat the dryness. Okay.
So the dry eye can be cured.
It can be cured if we can prevent
What is
it
the
from
indication
become worse.
Of the dry eye.
Say again.
What is the indication of the dry eye?
Okay. So who will actually get these dry eyes?
For those who are wearing contact lens.
Yeah, you will get a little bit of dryness. And those who are, every day, everybody now is using all the electronic gadgets. So that again causes dryness. And those people who are taking a lot of medication, diabetic, again, heart problem, allergies and all that all can cause dryness. Okay, nowadays we are getting a lot of Steven Johnson syndrome patients. Steven Johnson is you have got a very severe dry eyes that you totally lose all the mucus in your body. Meaning if you want to swallow food also, it's going to be difficult because you don't have liquid in your body, you don't have fluid in your body. So same thing, if you have got very severe dry eyes, it's not going to be comfortable, it's going to be painful, it's going to be pricky pain, so you need to be treated. So how do you know that? Is through eye examination. Okay, if you just walk into the pharmacy, the pharmacist can give you some medication to soothe that problem, but you have got to start knowing the source of the problem, from the roots. Then only you can cure. Not trying to get some medication just to help you for a short period of time. But
it's more to assumption when we ask for medication, right?
Yeah.
So I think my eye got some problem. So what type of medication can I have?
Because like those eye drops which is being sold in the pharmacy, the normal common brands, yeah, you are not supposed to use it too many times. Sekali-sekala boleh lah, not all the time. If you are using it like you are putting every hourly, you are putting in the drops.
eye drops, okay.
Yes, you'll end up with solution toxicity, eye drop toxicity, chemical toxicity. So
1 to 2, 3 drops. Okay.
yeah, the indication on the box will say
2 to 3 drops.
2 to 3 drops a day, right?
A day or per use?
A day. Usually it's a day because
so
it
per use
contains.
is only 1 drop enough.
So you can go maximum 3 times a day.
3 times
so,
a
but
day?
then if you use more than that,
So
it can
every time
cause.
we how many drops?
So each time you just put 1 drop. 1 drop will do.
1 drop enough.
Just 1 drop. 1 drop is good enough. Okay, but then you can repeat it like twice, 3 times, and then if you go more than that, it will cause toxicity.
Toxicity.
That means it becomes very, very toxic to your eye.
Means it's
So,
not safe for us.
which
for
is
to use
not
the
going to be
eye
good.
drop.
Yeah, because it contains preservatives. That's why when you want to be recommended of eye drops, it has got to go through a proper channel. So pharmacies sometimes they'll just give you just to short-term result lah, just a
Sometimes
short-term.
I'm wearing the eye drop to reduce the dryness of my eyes when wearing contact lens.
Yes.
Is it okay?
Yeah.
I'm using
but
the brand Optrix. It's suitable for lenses.
yeah,
So
it
the
has
type
got these
of the-
preservatives. You have got to use it with care, meaning that you cannot be like putting it like every hourly,
Not
but you
frequently
can
lah,
use
just
it like 3-4 times a day.
3-4 times a day.
Maximum. So that's about why you need to have a slit lamp biomicroscopy check onto at least now, have it go, just go for this examination at least once a year, just an annual checkup. Okay. So usually when we have run through all the eye examination series, okay, so the optometrist will conclude the findings, what's wrong with your eyes and your potential for what, or if you have got problems, we will give you the treatment method, okay, how to manage your problem and all, and then we will suggest to you what are the optical aids, accessories, even contact lenses, what type of contact lenses you should be wearing, and maybe what brand or how long you should be wearing in a day, because we have got different types of contact lenses. Do you know, Adi? We have got like
Yes.
daily wear, monthly wear.
Yeah.
We have got continuous wear where you can wear for 30 days non-stop.
Okay.
Yeah, like what I'm prescribing to those yang
Is it safe
pergi.
to use it
Yes.
for?
But you have got to make sure that you got to the right brand. So we have fitted a lot. Yang
Can
nak
you use
pergi.
it during the sleeping?
Yes. We are fitting a lot now for those people who are going for Mecca, for Haji.
Yeah.
Yeah, so they are going for 40 days. So we are prescribing a lot that they can actually sleep. They have got some medical conditions which they have got to wear contact lenses most of the time. So they are wearing the type which they can actually sleep with the contact lens in the eye for 30 days.
For 30 days,
30
24
to
hours,
40 days lah.
30,
Until they come back from Mecca. So we have got that as well. So that's why you have got to know. So we will suggest to you whether you will be more suitable to wear spectacles or more suitable to wear contact lenses. Pun. Okay? Not everybody can actually wear spectacles. Those people who has got keratoconus, have you heard of it? It's an eye condition whereby they cannot wear glasses. It will not help.
Why?
So they have got to, because their
When
cornea
they wear the glasses, what effect to him?
distortion, bad distortion.
Distortion.
It doesn't help. So it's better for them to not wear their glasses even. They can't walk, because the vision will be very distorted. So for this type of condition, we will suggest them to wear contact lenses. A special type of contact lenses is the rigid type, not the one that you're wearing, the soft type. So that's specialty contact lenses. So then we will actually diagnose if you have got any systemic disease. If I think that you might have diabetes and all that, I will just get you to be referred to other hospitals to get your health check. And then that's when we do all this consultation. So this is the series that we will do for the eye examination. It's just not an eye test. Banyak kan? And dia penting. Tak boleh shortcut.
Ada juga contact lens yang implanted kan? Yang
Yes, ICL. That also
what kind of patient will wear the implanted lens?
the ICL, is it? They have got some people who can benefit from there. Not everybody, yeah. Some people who has got very high power, yeah, but can benefit. But of course, there's always advantages and disadvantages. You need to do your homework first before you go for that procedure. Because this is surgical procedure. Once you have done it wrong, you can't reverse, ya. Nanti kita PM tepi pasal ICL. Okay, so get your chance now. We are here. So this is 360 Apex. So now you know that we are going 360 all around to do our eye examination. We are looking not just at your vision, but we are doing an overall examination. Yeah, the inside, the front and the back and the pressure and everything, just to make sure that you will have a healthy vision and you will have healthy eyes throughout your life. Okay, so grab the opportunity because only at Focus Point we have all these facilities.
Okay, very interesting. Thank you for the sharing. Professor Madam Dr. Haliza from UKM.
Yeah, welcome.
Thanks for being with us. Jadi kami sangat berbesar hati atas perkongsian tersebut.
Banyak tak belajar?
Banyak sangat belajar dan sangat banyak manfaatnya. Jadi semoga Allah membalas jasa dan perkongsian ilmu ni dengan berlipat ganda kebaikan lagi untuk doktor ya. InsyaAllah. Jadi terima kasih atas perkongsian. Thanks for the sharing session. And if we're gonna have another sharing session after this. Right. Yes, this is the time. 1:30 already. And of course, we want to express our appreciation and very many thanks to Doctor. Thank you, Doctor.
Okay, thank you, Adi.
Okay.